Okay, let's dive right into this. Pregnancy blood pressure spikes? They can be absolutely terrifying, right? But the thing is, they aren't just random. Today, we're going to decode exactly what's happening in this rapid fire explainer, and we're doing the whole shebang in under 2 minutes.
So, what actually happens when blood pressure shoots up during pregnancy? Well, I was fascinated to learn that it is definitely not just a single isolated event. It is a very specific, predictable escalation arc. Let's trace exactly how this unfolds.
Now, to do this, we are grounding our explainer entirely in these actual clinical notes. And hey, do not worry at all about the medical shorthand you're seeing here. We're going to decode all this heavy jargon into plain English together. All right, so it all starts with a baseline condition called pregnancy-induced hypertension, or PIH for short. The trigger here is a blood pressure reading hitting 140/90 or higher that develops specifically after the 20-week mark of gestation. But the absolute key takeaway at this stage, there is zero protein in the urine, and things typically just go right back to normal after delivery. Now, what's really interesting about this is the exact point of escalation. Like we just said, PIH has no protein. But the literal minute a patient hits 300 milligrams of protein in their urine over a 24-hour period, or starts showing signs of end organ dysfunction, boom, the diagnosis shifts immediately to preeclampsia. We have officially entered the danger zone. And if that progression isn't stopped, we hit the absolute critical peak, eclampsia. The medical notes describe this terrifying stage as introducing tonic-clonic convulsions. But in plain English, that just means severe neurological disorders and the sudden onset of highly dangerous seizures. So, putting it all together, you can really think of this as a 4-step severity staircase. We move from standard gestational hypertension, step up to mild preeclampsia, climb into severe preeclampsia, and finally peep at eclampsia. And this brilliantly illustrates how the medical response has to scale perfectly with that danger, step for step. Mild preeclampsia, well, that might just require some simple bed rest, but severe preeclampsia demands strict, continuous hospital management. And if we reach that eclampsia stage, doctors have to bring out the heavy hitters, intervening with magnesium sulfate just to stop those seizures. It's an incredibly fast and terrifying progression if it gets missed, which really leaves us with one crucial final thought to chew on today. Are we actually doing enough to monitor that critical 20-week milestone in everyday prenatal care? Because catching this at the very bottom of the staircase, that makes all the difference in the world.